Horses' teeth actually grow, so they'll continually grow throughout their life. And there's a part of the table surface of the tooth that comes in contact with the opposing tooth, and there's also a part of the tooth that hangs over the edge. So that part that hangs over the edge doesn't have anything to wear against. So when they eat grain and when they eat food, it will wear down the table surface, but there's an edge on the teeth that gets really, really sharp points. And those points cause a lot of problems. It causes ulcers inside the cheeks, on the tongue, can make it difficult for them to eat. It can also cause them to have TMJ problems or temporomandibular joint problems. So routine dentistry is really, really, really important to keep horses healthy and happy. It makes them a lot more comfortable in the bit as well. So the big misconception is that young horses don't need that as much. Their teeth are actually really, really soft. They grow very, very, very fast, so they get a lot of sharp, sharp points. So specifically with having a bit in a horse's mouth, they'll have really sharp points, so it makes it difficult for them to respond to the bridle without having some pain. So definitely make sure that you're doing this at least once a year. You're feeling all the premolars and the molars, which they have a lot of teeth in the back of their head that people don't even know that they have sometimes. And they get a whole bunch of sharp points on those teeth, so it makes it really difficult for them to chew.
Ulcers in their cheeks.
Yep. And this horse is 30, so he has some uneven wear. Normally all of these teeth are really, really straight and smooth, but he's got some uneven wear because of his age. So I'm using a Swiss float. It's got a spinning disc, doesn't hurt. As you can see, I can run this on my fingers. It's not gonna hurt at all. So if for some reason we were to hit the tongue or the cheek or anything, it's not gonna hurt at all. This little spinning disc, once it comes in contact with the tooth, will just smooth those points down, make the tooth really, really, make it a lot more comfortable for the horse to chew. This also kind of feels a little funny to the horse, but it's not painful, so we're not doing anything that's to the sensitive part of the tooth. We also used to have to do this by hand, so now we have a lot of instruments that work much, much better and cause a lot less trauma to the mouth than by doing this by hand. He's also got some pretty large ramps, so the very last tooth on the lower arcade of teeth is quite a bit longer than the rest of the teeth. And eventually that can actually poke in the roof of his mouth, make it really, really uncomfortable. So as you can see, dentistry is just really, really important. And unfortunately, what you can see is just really not telling you the whole picture, because most people can only see the incisors, and the incisors are just a couple of the teeth that they have. Most of their and that's mostly for prehension, the teeth in the front. So that means just grabbing the food and then putting it in the back of their mouth. So all the important teeth for mastication or chewing are in the back. So it only takes me a couple minutes. I'm able to smooth down all of those points. In this particular horse, it took us a couple extra minutes, but not long, because he had some ramps and a little bit of uneven wear. However, a couple minutes of doing dentistry, and he's gonna be comfortable again for at least 6 to 12 months. So it's certainly worth it. So yeah. So again, it's all the very simple things with horses. Nutrition is really, really critical, and they're not getting a lot of nutrition if they can't chew well. So once a year dental procedure done by Fox Creek, and your horse will be good to go.